Congestive heart failure. Congestive heart failure, CHF, is a complex and progressive clinical syndrome that results from the heart's inability to pump blood effectively to meet the body's metabolic demands. It is a condition characterized by signs and symptoms that indicate the heart's compromised ability to maintain adequate circulation. Despite advances in medical science, CHF remains a significant global health concern, with high morbidity and mortality rates. This comprehensive overview aims to delve into congestive heart failure's intricate aspects, including its pathophysiology, causes, clinical manifestations, diagnostic approaches, and contemporary management strategies. Understanding the pathophysiology of congestive heart failure is crucial for grasping the intricate mechanisms that lead to its development. CHF often stems from structural or functional abnormalities that impair the heart's ability to pump blood efficiently. The two primary types of heart failure are systolic and diastolic, each presenting distinctive pathophysiological features. Systolic heart failure. In systolic heart failure, the heart's contractile function is compromised, leading to a reduced ejection fraction, the percentage of blood ejected from the heart during each contraction. This impaired contractility may result from myocardial infarction, cardiomyopathies, or chronic hypertension. As the heart struggles to pump blood, it activates compensatory mechanisms, such as the renin-angiotensin-aldosterone system, ROS, and sympathetic nervous system, which, over time, exacerbate the condition. Diastolic heart failure. Diastolic heart failure is characterized by impaired ventricular relaxation and increased stiffness during the filling phase of the cardiac cycle. Common causes include hypertension, hypertrophic cardiomyopathy, and restrictive cardiomyopathy. Unlike systolic heart failure, patients with diastolic dysfunction may have a preserved ejection fraction. The pathophysiology involves elevated ventricular filling pressures, leading to congestion in the pulmonary and systemic circulations. Causes of congestive heart failure. Numerous factors contribute to the development of congestive heart failure, ranging from lifestyle choices to genetic predispositions. Understanding these causative factors is vital for both prevention and targeted intervention. Major causes include coronary artery disease, CAD. Atherosclerosis affecting the coronary arteries can lead to myocardial infarction, causing irreversible damage to cardiac tissue and impairing the heart's pumping ability. Hypertension. Prolonged high blood pressure imposes an increased workload on the heart, leading to hypertrophy and eventual heart failure. Cardiomyopathies. Various cardiomyopathies, including dilated, hypertrophic, and restrictive types, can result in structural and functional abnormalities, contributing to heart failure. Valvular heart diseases. Malfunctioning heart valves, such as aortic stenosis or mitral regurgitation, can disrupt normal cardiac function and lead to heart failure. Myocarditis. Inflammation of the myocardium, often due to viral infections, can weaken the heart muscle and contribute to heart failure. Genetic factors. Some individuals may have a genetic predisposition to heart failure, with familial clustering observed in certain cases. Diabetes. Chronic uncontrolled diabetes is associated with an increased risk of heart failure, likely due to its impact on blood vessels and the heart muscle. Obesity. Excess body weight is linked to an increased risk of heart failure, possibly through mechanisms involving insulin resistance, inflammation, and hemodynamic changes. Clinical manifestations of congestive heart failure. The clinical presentation of congestive heart failure is diverse, encompassing a range of symptoms and signs reflective of its systemic impact. These manifestations can vary based on the type of heart failure, the underlying cause, and individual patient factors. Common clinical features include dyspnea. Shortness of breath, especially during exertion or while lying down, is a hallmark symptom of CHF. It results from pulmonary congestion and impaired gas exchange. Fatigue and weakness. Reduced cardiac output leads to decreased oxygen delivery to tissues, causing generalized fatigue and weakness. Peripheral edema. Fluid retention, often manifesting as swelling in the legs and ankles, peripheral edema, is a consequence of increased venous pressure and congestion. Orthopnea and paroxysmal nocturnal dyspnea. Difficulty breathing while lying flat, orthopnea, and sudden nighttime breathlessness, paroxysmal nocturnal dyspnea, are characteristic features of CHF. Cough. Chronic cough, sometimes with frothy or pink-tinged sputum, can result from pulmonary congestion and fluid accumulation. Cyanosis. In severe cases, inadequate oxygenation may lead to cyanosis, a bluish discoloration of the lips and extremities. Tachycardia. The heart may compensate for reduced cardiac output by increasing its rate, leading to a rapid and often irregular heartbeat. Diagnosis of congestive heart failure. Accurate and timely diagnosis of congestive heart failure is crucial for initiating appropriate treatment and optimizing patient outcomes. Diagnostic approaches encompass a combination of clinical evaluation, imaging studies, and laboratory tests. Key components of the diagnostic process include clinical history and physical examination. A thorough assessment of the patient's medical history and a comprehensive physical examination, with attention to signs and symptoms of heart failure, provide essential initial diagnostic information. Laboratory investigations. Blood tests, including B-type natriuretic peptide, BNP, and N-terminal pro-B-type natriuretic peptide, NT-proBNP, help in assessing the severity of heart failure. Other tests may include complete blood count, electrolyte levels, and renal function tests. Imaging studies. Echocardiography is a fundamental imaging modality that provides detailed information about cardiac structure and function. Other imaging techniques, such as cardiac magnetic resonance imaging, MRI, and computed tomography, CT, may be employed for specific cases. Electrocardiography, ECG helps identify rhythm disturbances, ischemic changes, and signs of left ventricular hypertrophy, contributing valuable information to the diagnostic process. Chest X-ray. Chest radiography assists in evaluating cardiac size, pulmonary congestion, and the presence of pleural effusions. Exercise testing. Treadmill or bicycle exercise testing can be utilized to assess exercise tolerance, identify exertional symptoms, and evaluate functional capacity. Management of congestive heart failure. The management of congestive heart failure is multifaceted, involving pharmacological and non-pharmacological interventions aimed at alleviating symptoms, slowing disease progression, and improving quality of life. Treatment choice depends on the underlying cause, type of heart failure, and individual patient characteristics. Key components of CHF management include pharmacotherapy. 1. Angiotensin-converting enzyme, ACE, inhibitors and angiotensin receptor blockers, ARBs. These medications antagonize the effects of the renin-angiotensin-aldosterone system, reducing vasoconstriction and sodium retention. 2. Beta blockers. Beta blockers, such as carvedilol and metoprolol, improve cardiac function, reduce heart rate, and mitigate the adverse effects of sympathetic activation. 3. Diuretics. Diuretic agents, such as furosemide, help alleviate fluid retention and reduce symptoms of congestion. 4. Aldosterone antagonists. Spironolactone and eplerenone, which block the effects of aldosterone, can be beneficial in certain cases. Device therapy. 1. Implantable cardioverter defibrillator, ICD. ICDs are indicated for patients at risk of sudden cardiac death due to ventricular arrhythmias. 2. Cardiac resynchronization therapy, CRT. CRT, delivered via a specialized pacemaker, can improve the coordination of ventricular contractions in selected patients. Surgical interventions. 1. Coronary artery bypass grafting, CABG, for patients with coronary artery disease contributing to heart failure. CABG may be recommended to improve blood flow to the heart. 2. Heart transplantation. In severe cases of heart failure refractory to medical therapy, heart transplantation may be considered. Lifestyle modifications. 1. Dietary changes. Sodium restriction is often advised to manage fluid retention. 1. In some cases, fluid intake may also be restricted. 2. Physical activity. Regular, moderate exercise can improve cardiovascular fitness and overall well-being. Patient education and monitoring. 1. Patients are educated about the importance of medication adherence, symptom recognition, and prompt reporting of changes in their condition. 2. Regular follow-up appointments and monitoring of clinical and laboratory parameters help assess treatment efficacy and adjust management as needed. Prognosis and complications. The prognosis of congestive heart failure varies based on its cause, severity, and the effectiveness of therapeutic interventions. Despite advances in treatment, heart failure remains associated with a significant risk of morbidity and mortality. Complications of CHF include cardiac arrhythmias. The compromised cardiac function in heart failure increases the risk of arrhythmias, including atrial fibrillation and ventricular tachycardia. Renal dysfunction. Reduced cardiac output and congestion can lead to impaired renal function, contributing to a vicious cycle of worsening heart failure. Pulmonary embolism. Stagnant blood flow and increased clotting risk in heart failure patients may predispose them to pulmonary embolism. Liver dysfunction. Congestion in the hepatic circulation can result in hepatic impairment and alterations in liver function tests. Cachexia. Severe heart failure may lead to cachexia, a state of muscle wasting and weight loss, further compromising the patient's overall health. Congestive heart failure represents a complex clinical syndrome with multifactorial etiology and diverse manifestations. Advances in our understanding of the underlying pathophysiological mechanisms have led to significant improvements in the management of this condition. A comprehensive approach that addresses the root causes, symptom relief, and lifestyle modifications is essential for optimizing outcomes in individuals with congestive heart failure. Ongoing research continues to explore novel therapeutic strategies and refine existing approaches, offering hope for enhanced patient care and improved quality of life for those affected by this challenging cardiovascular condition. Before we sign off, a friendly reminder: this video is meant for educational purposes only. Your health is a priority, so always consult with your healthcare provider for personalized guidance. If you found the information useful, consider sharing it with your friends and family. Stay in the loop by subscribing to our channel and hitting the notification bell for the latest updates. Additional videos on health and lifestyle might be tempting you right now. Click on any that catch your interest. Thanks for tuning in, and until the next video, take care.